Hi, my name is Julie, and for my demonstration today, I'm going to show you how to administer a TB test. So this is a good visual aid to show you just the three-step process here. Administration, reading, and interpretation. But for the purposes of this demonstration today, we're just going to focus on the administration piece of the TB testing. So what is a TB test, or more importantly, what is TB or tuberculosis? Tuberculosis is a highly contagious disease that is primarily seen in the lungs. A TB test is a mechanism or a tool that a healthcare provider uses to determine whether a patient has been exposed to the TB germ. So some of the supplies that we're going to use today is the TB testing. In our case, we're going to use Turbisol, but there are other brands out there that can be used. We're going to use a TB syringe, has a little bit smaller barrel and a smaller needle. 2 alcohol prep pads, and a sponge gauze pad for wiping off any fluid or blood that may come out of the injection at the end. As always, with any kind of procedure that you do for a patient, hand sanitizer or washing your hands properly and gloves are extremely important to make sure that you don't contaminate or cross-contaminate the patient. So we are going to come over here today to the table for our demonstration, and this is Lindsay. Lindsay is my instructor, and she's going to be my patient today. So we have all of our supplies laid out here and ready to go. For the purposes of our video today, I've already drawn up my TB syringe, and it'll be ready to go. But one of the first steps that you want to do with this injection or any injection is you want to make sure that you have patient identifiers, their name and date of birth, and that you want to make sure that you're giving the proper medication to the proper patient. In the case of this TB skin test today, we're going to choose a site. So the first thing we want to do is look at the lower anterior arm. And we're going to focus on this area here, but in general, you want to have maybe 4 fingers, which is like 2 to 4 inches down from the crease of the elbow here. So we're going to focus like right here in this area for the injection. So the first thing we do is we are going to cleanse this area here in a circular motion, and then we're going to let it dry. While we're doing that, I'm just going to prepare this syringe. Now this injection is intradermal, so that it means that it's just going to be just below the surface of the skin. We're just going to plant that just below and right into the epidermis. We're going to do this at about a 5-degree angle. I'm going to plant just carefully right here and holding that steadily. What we want to see is the skin start to erupt a little bit and create what we call a wheal. If you have a wheal, that means that you've had a successful plant of the TB shot. We're going to engage the safety, and we will dispose of that in the sharps container. So with this, there is a slight wheal there. There's a little bit of blood coming off of that, and we just want to wipe that gently. You don't want to put a Band-Aid on this because we don't want the adhesive on the Band-Aid to irritate the skin in that area, because it could potentially cause a false positive on this test, and we don't want that to happen. So we're going to instruct the patient not to put a Band-Aid on this and to try to avoid itching and scratching that area. And then most importantly, we need a commitment from the patient to return in 48 to 72 hours to read the result of this test. It's very important that we have that commitment from the patient to return. Okay, and that ends my demonstration today of how to plant a TB test. Thank you.